share in this time. Okay, we start from why should breast milk like that, because we know that breast milk is the best nutrition for the babies, especially in the first 6 months. So WHO let already declare for all of the world that we have to give breast milk exclusively for the baby for 6 months. The babies who breastfeed milk exclusively, we know that they will get a natural immune which protect the babies from any disease. The nutrition value in the breast milk provide the nutrition need for the baby's growth and development. We know that. And then the colostrum, the first milk in yellow colors from the breast milk, then come out the first time, that very good because it give active immune to the baby that protect the baby from some illness. Breast milk insufficient in the baby may cause delay in the baby weight gain, and we know that if there is delay the baby weight gain, it means it will influence the growth and also the development of the babies. And then when we look at the side of the mom, why mom should breastfeed, we can see that a lot of benefit when the mother breastfeed of the baby. Initiation of breastfeeding immediately after delivery stimulate the release of oxytocin. This is the hormone that help to contract the uterus, expel the placenta, and reduce postpartum bleeding. So you know that is very good. By breastfeed, we can reduce the postpartum bleeding or bleeding postnatally. And then breastfeeding also delays the return of fertility, thus reducing exposure to the maternal health risk associated with short birth interval. In the longer term, mother who breastfeed tend to be at lower risk of premenopausal breast cancer and ovarian cancer. So it will be great for the mother when they breastfeed for the baby. The analysis reviewed here how clearly that apart from being the safest and healthiest, safest for the baby and healthiest feeding method for the infant, breastfeeding is also, we know that they're very least expensive. So because we don't need to spend a lot of money for buy some formula feeding or something like that. But we know that not all mother, and now the coverage of exclusive breastfeeding is still low. It's around 30 until 40%. So why should that happen? Some barrier in breastfeeding is still available at the moment. Like in my country, for example, we have many myths. Yeah, it's very strong myth. Sometimes, community or people believe that consuming fish is believed cause of fishy smell and taste of breast milk. We know that fish is very good, nutritious food for mother to make a good quality of breastfeeding. So when they don't eat, so we know that the quality of breastfeeding is not really good, even also for the quantity. The other meat is, for example, egg and meat which high in protein content are not recommended for postnatal women because it is believed inhibit the healing process, like the wound of the perineal after deliver the baby or the wound in the uterus. They have a myth like that. So sometimes they don't eat eggs and meat during the breastfeeding period. So it's not very good. The mother are not allowed to sleep in the midday because they believe it will cause an hypertension in the mothers. As we know that my body is need a rest, so when in the midday they don't allow it to be sleep, it's very terrible if for at the moment they want to sleep like that. So we know that sleeping or rest is important in the process of cell generation and breast milk production. And then beside external barrier, we also have internal barrier in breastfeeding. Yeah, sometimes the mother need actualization need, and regarding the body image after labor become main concern of postnatal women. They don't want to be fat. They don't want to be fat. So some breastfeeding women tend to avoid consume more food. The increasing of body weight during pregnancy influence the psychologies of the mother. This is wondering, really, because when they consume less food, so again, the quality of and quantity of breast milk, it should be not good or should be bad. And psychologically, when the mother has a problem psychologies, it really will give a negative impact for breast milk production. And during the COVID-19, we have another main concern now. Besides some barrier for breastfeeding, now we have a main concern. Some mothers or some people doesn't know or lack of knowledge regarding how to breastfeed in pandemic COVID-19 situation. They don't know where is the best way how to breastfeed for the baby during COVID-19. So sometimes they worry, some stop for breastfeeding, and some continue breastfeeding but with worrying and something. So here is regarding the WHO, because of at the present data are not sufficient to conclude vertical transmission of COVID-19 through breastfeeding, so WHO recommended that the baby should be continue breastfeed during pandemic COVID. And it's still not clear whether the virus can or cannot be transmitted through breast milk. So it's still not clear. So again, this is supported that every mom, every breastfeeding mom should breastfeed their baby. And then when we compare to exclusively breastfeed infant, the risk of mortality is 14-fold higher in infant who are not breastfeed. So this is another fact that exclusive breastfeed is very good for the baby. So WHO recommended mother with suspected or confirmed COVID-19 should be encouraged to initiate or continue to breastfeed. Mothers should be consoled that the benefit of breastfeeding substantially outweigh the potential risk for the transmission. And then here is advice to breastfeeding mother that we can make advice that the babies during COVID-19 pandemic has to be breastfed because it's still needed to increase the immunity of the baby. But during breastfeed, they still have to do the health protocol regarding COVID-19, that the mother practice respiratory hygiene and wear the mask during contact to the baby, whether when they breastfeed or whether they not breastfeed. I mean, beside another time when not breastfeed. And then the mother has washed hand before and after touching the baby. And then routine clean and disinfect the surface where is the baby over there. And then that's very general. This is additional advices that we can give to the mother during the breastfeeding mother during pandemic COVID. Suggest them to consume nutritious food, and then do daily exercise, get some vitamin if needed, and then get enough rest. And we still keep social distancing. And then here is when the situation is woman with COVID-19 is too unwell. She is infected and the unwell condition. So to breastfeed, she can be supported to safely provide her baby with breast milk in another way. For example, still use the milk or the milk, but they express the milk. So they don't give straight away. The baby don't sucking directly to the nipple of or the breast of the mother, but the mother express the milk and give to the baby using a spoon or maybe using a bottle. And then they also can do can get the baby can get the breast milk from the human donor human milk. And then if the expressing breast milk or donor human milk are not visible, then if not visible, so then consider infant formula as the last option. Infant formula milk with measure to ensure that it visible, correctly prepared, and safe and sustainable. I think that is all of my presentation. Hopefully you can understand what I said, and this is just sharing about knowledge and then experience regarding situation of one situation related with COVID-19. Thank you very much. Good afternoon, everybody.
Thank you, Vijyanti, for a wonderful presentation. And really, we all know that in this pandemic, how the world is suffering with this pandemic, and the pregnancy ladies and basically the kids, newborn babies, had to suffer also with respect to COVID-19 and all. So it's very difficult to handle the situation, and you have given such a wonderful presentations and tips with respect to this particular presentation. Do share this presentation with all if possible, so that people, it will be very nice for the people to understand and get much more knowledge with respect to awareness with respect to this pandemic situation.
Thank you. Okay, may I stop my screen share?
Yes, sure.
Okay.